Please welcome our next guest, Dr. Mark Filidei.
So, we're going to talk about how to keep the golden years golden, and maybe how to prevent the decline that we see in a lot of folks. This will hit home for a lot of you personally as well, as it does for many of us. So, imaging the brain. There's several different ways you can look at the brain, but what we don't want to look at the brain anatomically. We want to look at it functionally, metabolically. And you do that with a SPECT scan. So SPECT scans look at blood flow in the brain. So this is what we see. This is a normal brain view from the top and the bottom. So, and this is not an anatomical study, so we're not looking at the tissue, we're looking at the blood flow. And that's important, because you're going to see some subsequent slides. It would be scary if it actually looked like that. So normally what we see is we want to see it symmetrical. It should be even on both sides. All the parts should be there and full. Kind of a nice fluffy, puffy looking brain. These don't look so good. So this is the same views, but obviously there's a big problem here. So these are different kinds of dementia. Dementia is basically damaged nerve cells that result in all the problems we know associated with dementia. Memory loss, cognitive decline, etc. So, what are your risk factors for developing dementia? So this is part of kind of what I do, the metabolic workup, finding out what's going on with your lifestyle. So ApoE gene, this is a known risk factor for developing Alzheimer's, cardiovascular disease. It's a simple blood test. It's actually a simple genetic test. How many folks have done a 23andMe gene test? Anybody? No. Oh, highly recommend it. It's $99. You get your almost entire genome information back. One of the tests is the ApoE gene, but you get hundreds of other things that you're at risk for. Again, not that you're going to get it. It's about the hand of cards you've been dealt at birth genetically. Are you predisposed to Alzheimer's, diabetes, different kinds of cancers? You'll know your genetic hand, but you can do things to overcome those problems. Alcohol abuse, heart disease, vascular disease. And if you exercise less than twice a week, that's a risk factor for developing dementia. A less formal education. Diabetes, smoking, Parkinson's, untreated depression, and ADD are risk factors for developing dementia. And low hormone levels from hysterectomies. Low testosterone levels, sleep apnea. Sleep apnea is a big problem. It's very underappreciated. It's very common. So I've probably diagnosed, I'm sure, over 1,000 patients with sleep apnea over the years. And if somebody comes in to see me and they are on more than 2 blood pressure pills, it's almost a guarantee of having sleep apnea. Cancer treatment, so chemotherapy and chemo brain, not good for your brain long term either. Homocysteine levels. So homocysteine is something we all make. We're going to talk about lab testing here soon. But if that gets too high, that's another risk for Alzheimer's, as well as heart disease. That's usually from B vitamin deficiency and poor diet. So how do you prevent this from happening? Well, again, you have to know your risk and change your risk. Your ApoE status is one of these tests that's good to have knowledge of. Exercise, brain exercises. So everyone always says, keep your brain busy. Crosswords, Sudoku, whatever you want to do, just keep your brain working. It's better for you. Low dose aspirin, so anti-inflammatories help. One reason is because inflammation is key to so many diseases, including Alzheimer's. There's supplements you can take. You can take ginkgo. We have several supplements at the Amen Clinic that are geared specifically for boosting brain function. We have one called Focus and Energy. We have something called Brain and Memory Power Boost. These are all been found. They all contain multiple supplements that help your brain. Coenzyme Q10, really important. Coconut oil, super good for your brain, as well as everything else. So we have all of our brain health patients, whether they were preventive or treating. Coconut oil. You can take a scoop of coconut oil, which is solid room temperature, throw it in your smoothie. Saturated fat, as we just heard this morning, is good for your brain. Exercise, again, if you exercise less than twice a week, that's an increased risk for developing dementia. So exercise is good for everything. Increases cell repair, blood flow to the brain and everywhere else. You actually detoxify when you sweat. You're sweating out toxins. So sweat is good too. Vitamin D, again, as mentioned earlier today, you want between 60 to 80. Vitamin D prevents 19 and counting different kinds of cancer, including breast, colon, prostate. It's more beneficial than any flu shot would ever be to prevent the flu or other problems. Testosterone, really important hormone. Insulin, again, looking at your blood sugar. CRP is another one especially important for dementia. That's a marker of inflammation in your blood vessels. So what are signs of low thyroid? Well, thyroid, everything slows down. Your thinking, your bowels, your skin, everything. Your dry skin, hair falls out, eyebrows start thinning, you're constipated, fatigued, can't think, memory loss, depression. So the muscle weakness, very common. I mean, who doesn't come into a doctor's office with like at least one of these things going on? Estrogen, this is from Dr. Amen's recent book, Unleash the Power of the Female Brain. So especially with dementia, as we'll see here in a minute, estrogen makes you think better. Postmenopausal women, estrogen replacement improves cognition. So low estrogen, irritability, hot flashes, pain, low libido, insomnia, all sorts of issues from low estrogen. Fuzzy thinking. So when you replace estrogen, this is postmenopausal, you of course can eliminate your symptoms like night flashes, hot sweats, but you help maintain bone density. It has anti-aging effects, very likely decreases Alzheimer's damage. So this is LA Times. This is a recent article, 2013 March. Headlines: Study upholds cancer mortality for hormone replacement. Okay, well, who's not going to read that and go, oh man, I better get off hormones right away? Well, in the same study, just further down on the back page part of it, that most people never get to because they're so afraid of the first paragraph, it says this finding applies only to women who take estrogen and progestin. Oh, they didn't mention that. A synthesized form of the natural hormone progesterone. Women who take estrogen alone, it doesn't seem to increase breast cancer risk. So the title of this article should have been Synthetic Progesterone Linked to Breast Cancer. That's the case. Synthetic progesterone you never want to take. The progestins are what have been linked to all the problems and all the cancer studies. So this is the stuff you don't want to take. Synthetic progestins. There's absolutely no reason to take this stuff. Natural progesterone is available. It's always been available. It's in the PDR. It's called Prometrium. It's bioidentical natural progesterone. Works absolutely fine. So all the stuff that's bad. So natural progesterone has none of those problems. It's spectacular for women with PMS, especially. You can eliminate PMS with progesterone. It can go away. Dr. Amen's wife, Tana, has an Omni diet book out. She's also on PBS a lot as well. So it's really similar to what you already heard. We are not vegetarian proponents, we're vegan proponents. 70% plants, 30% protein. Nutrigenomics, that was touched on earlier as well, but the food you eat talks to your genes. So again, you're given a hand of cards at birth, your genes. Now what you do with those, as far as turning them on and off, is what you do. You're doing it. You're either doing good or bad for your epigenetics. Gluten, another big issue. As was mentioned earlier, gluten can cause so many problems. We have a nutritionist in New York. She sees all of our nutrition-related patients, and she will send us stories about patients that came in that have 18 things wrong. If they have insomnia, anxiety, bloating, weight issues, did a laundry list. And she puts them on a gluten, dairy, sugar-free diet, which is what we're talking about anyway. They come back a month later, 2 months later. There's nothing wrong anymore. I mean, they're all gone or dramatically better. It can be that dramatic. Eat from the rainbow. Again, colors are nutrients. Different colors of nutrients affect different parts of your body. So purple, really good for the brain. Different colors actually are good for different parts of your body. So colorful stuff is good. Sleep, super important. Your brain detoxifies when you sleep. It improves your memory. So that's why and proper sleep is just really critical. And this goes with the sleep apnea issue I mentioned too. So when you lose sleep, you get low blood flow, bad decisions, bad memory, and it makes you fat. It's kill the ants. Thoughts. We all have these. You get rid of these. That helps. Actually, you can see negative thought patterns in SPECT imaging on occasion. So your brain just doesn't look as good even. Supplements, fish oil, really good. Vitamin D, really important. I think those are the top two top guns. Fish oil, vitamin D. They're pretty much everybody should be taking.